Ayush ministry, developing some strength and courage, and issuing a notice to a Kerala doctor for defaming and denigrating Ayurveda. It is like to and fro, like I mean, we have in India, especially Ayurveda, Unani, homeopathy, yoga, and of course allopathy being the dominant one there. It's not a very healthy habit of throwing mud against each other and causing confusion on the public, both from allopathy side to Ayurveda and also Ayurveda side to allopathy. We are there to help general public with the best of the knowledge and best of the medical system and medical care that we can offer. So the concentration and focus should be there on serving the patients with the best of our knowledge rather than commenting on some science which we do not know much about. Sir.
Definitely. See, we should not venture into the area where we don't know the things. So when we don't know about Ayurveda, we should not comment on Ayurveda. Similarly, if we don't know about how a drug works, particularly in a particular area, when we are unaware of it, we should not pass on a loose comment. And here you can observe that whenever there is a surge in the people's appreciation and acknowledgement for Ayurveda, there always exists or there will be a one definite effort to put it down by the opponents, and they'll bring up something like this, some article or some quotations or some quote, some studies report or something like that in the media to highlight or bring down the popularity of Ayurveda. So that is a reason they always come out with this. During this COVID pandemic, the people are very well aware and they come to know about the qualities and even the efficacy and the ability of Ayurveda and their drugs. The people have started moving towards the Ayurvedic drugs for even other conditions also, other than the COVID. So this has definitely has made some scratching their heads. So they started to pump out these type of new what do you call reports and all those things. And of course, Ministry of Ayush at last has come out in the right direction, and with some nerves they have sent a proper notice, and they have done in a good intention, and that should be done. There should be somebody to look after the interest of Ayurveda, and at last they are in somebody in their position, they are carrying it out. So that's a good sign. And even that doctor, one who has passed on the unnecessary comments, you would have studied and you would have taken the information from other doctors or from the system of people, those who are dealing with those Ayurveda and all these things. He could have tried to understand its concepts. Then later would have at least accepted or not to. If anything has to be said against the Ayurveda, you should have some concrete evidence. Simply without any evidence, saying a wrong thing is always bad.
Yes, and we had a long discussion in our very first session with Guruji being called as hepatotoxic, just with some 6 random case studies, especially when when we are in a pandemic, when we are in a tight situation where we have to gather as much of help from all the medical sciences, and at a time when we are supposed to work as a team to come up with solutions. If we are quarreling or disrespecting each other, it will only cause confusion in the mind of the patients, and ultimately patients are the ones who will be disinformed and who suffer. So.
The reason is, during these pandemic and all these things nowadays, because of the very strong network of the social media, anything which is just passed on to the social media, it goes viral in a fraction of minutes all over the world. Everybody will be searching for that, and they'll be searching in such a words with that, and they'll try to put that efficacy Ayurveda and link it with that side effect and something like that. So that trying to tarnish the image of the Ayurveda, but that should not be the intention. Our intention has to serve the humanity. Whatever best possible, we can do it from whatever the science is available. And we know that this science is existing since so many thousands of years, and which stood the testing of time. The time tested medicine which has shown its efficacy, then there is something because anything which retains and stays there for thousands of years definitely has some potential that you need to accept that.
And also for young medical students, be it Ayurveda students or allopathy students, I think it should be taught in the first year itself that we should be respectful to the other sciences, and every science has their own advantages and their own areas of strength. If that is not taught, and if we have egoistic feelings, then those doctors who feel that only their medical science has big advantage and all other things are false science, they're going to hurt their patients, saying that, oh, you took Ayurveda medicine, it might have caused like liver damage, now go and get the scan done and whatnot. So it will steal the opportunity for the patient to benefit with Ayurveda herbs and other medicines, medical systems.
Definitely, there should be synergetic effect, and there should be synergy and even the cooperation between the different stream of medicines or the system of medicines. Otherwise, we may not be in a right way of situation explaining to the people or society. So we need to go by putting hand in hand, and that's why that's an integrated approach. Many a times, integrated approach of nowadays. Even in the COVID pandemic, also we observe that the people are now studying with ashwagandha along with the vaccine and such things, such things are there. So this is a very important area where we need to have, because in future integration is the right way of dealing the things. They are good things from each system has been taken and imbibed and into given to the society. Definitely the society will be at its best and it will be in a beneficial end.
And for the students of Ayurveda who are seeing this, best way to promote Ayurveda is not to get into quarrel or getting into which science is better or our science is better. Rather than arguing, showing results is one of the easiest way to win over even the doubters. And best example is like Dr. Gurada sir, who gets a lot of referrals from pediatricians for respiratory tract disorders, even liver disorders also. For Ayurveda, he gets reference from even the other counterparts also, sir.
Definitely, it is the area when we just simply talk and talk and talk, nothing can be delivered. See, when we say, okay, let us see how our drug works, you just see the result of our drugs, then automatically they will only ask and they will see how it is working. Then they will ask so many questions related to that. When we try to explain them, when we explain the concept of how our drug works, and we use the technical terms as well as how we interpret and you understand their language as well as their laboratory values and everything, then automatically they will be quite astonished and they will be many a times they'll accept. Even though they don't straight away, many times come in something like that, he has come out in open and said, yes, you have done a very good job, and no, they will simply keep quiet. At least they won't open their mouth in the public and say some nonsense. So that's why always our letters, our work speak, not our words.
And also to explain it to the patients in terms of scientific language and all. There was this interesting chat in the Quora platform, which is a question and answer platform. Like you have a child, and child is studying some fifth standard or sixth standard. So, which is the thing that you want the child to learn more so that he becomes a better person and a better professional when he grows big? And there was a conversation there, and many people were telling that it would be coding, computer knowledge, because any field that the child may take up, one of the, be it art or be it technology, computer is there. But there, one interesting opinion was that communication and control over language and how to use proper words in proper places and all. Probably Ayurveda people should also learn, and we have extra burden of first of all learning Ayurveda in properly, in terms of all the fundamentals correctly, and line of treatment and medicines and panchakarma. So we should be thorough with that, and we should have and we have the second burden of having a good control over understanding and interpreting the laboratory investigations and using that to our advantage, and also to communicate to the patients how it works, and gaining the confidence of the patients so that they take up Ayurveda treatment with confidence.
See, definitely there are three important areas. One is very effectively learning the things which is from the science. Second thing, how we could able to translate that thing into different languages. You know that in India we have a three linguistic teaching modalities, and we learn usually three languages: our mother tongue, and then English, as well as national language, Hindi or something like that. So we need to learn in these three languages, and we know the basics out of this. But if you can ask anybody to explain the thing in his mother tongue, definitely he will explain it in a very better manner by choosing a better terms. But when you need to explain it in a different languages, many times it requires a communication skill and a language hold that has to be learned, and that can be learned by regular practice. So Ayurvedic students who comes to this Ayurveda field definitely require some technical assistance or support and training in these areas of communication skills, as well as using the modern gadgets and even the computer technologies and certain areas of those things. I mean, that should be known to even made to learn these type of things as an extra subjects or something like that, or some mandatory papers or something like that. It should be slowly, if these things are introduced, definitely the future generation of Ayurveda students will be with a very better, they can communicate to the world, rest of the world.
Yeah, I still remember it was in 2001, 2002. We were going from second year BMS to third year BMS, and we were having like 1 month vacation. And you came to our class and said that, in the coming decades, computer science and computer knowledge is going to become big thing, and you better, rather than wasting 1 month of time at your hometown, spend time to learn computer and all. And I took that seriously, but I did not go and join computer class there. But while doing post graduation, I did a lot of course, CorelDRAW, Photoshop, basics of internet, Microsoft Word and all. And even after joining AVN Ayurveda as a deputy product manager also, I was doing a lot of computer courses, learning about blogging and all. So your advice back in 2001, 2002 has brought us together in after like 20 years now. So.
Definitely, you took that initiation in a right direction. That's why today Easy Ayurveda is a very popular one. That's the reason.
There's a little bit a marketing gimmick there, that because I write on very variety of topics, people think that I know the topic like from top to bottom. It's more like looking at the topics and in writing, and it is due to the blessings and the teachings of teachers like you that we are here.